Thank you, Madam Chair, and thank you again for having this hearing. Very important subject. According to the latest research by the Joint Center for Housing Studies at Harvard University, because of low incomes and limited assets, about 4 million senior households are eligible for rental assistance, but only about a third of those who need this help can actually get it. The problem is that the housing simply does not exist. And because of this affordable housing shortage, a large majority of low-income senior households face paying more than half their incomes for rent or living in severely inadequate conditions, or both of those. Now, there are a number of reasons for this shortage, but one of them is that in 2011, Congress cut off funding for the new construction in Housing and Urban Development's 202 program, which provides housing to low-income seniors. So, Ms. Garces, you are the co-leader of the Miami-Dade County Age-Friendly Initiative. I know that you're an expert on public policy issues affecting seniors, including housing assistance. Can you explain a little bit about how the 202 program works?
Sure. So thank you for your question. The 202 program, or the HUD program that was established in 1959, provides funding to private nonprofits in order to develop and operate housing and supportive services, and that's for very low or extremely low income seniors. And what we're seeing now, more than 430,000 seniors are engaged or are nationwide are living in those homes or in the program. In Miami-Dade, we have more than 7,000 units. The issue is the long waiting list. Many seniors are on these waiting lists, thousands and thousands, and many of them never are able to be removed from the waiting list. Another issue we are having, because construction, as you mentioned, Senator Warren, has not been granted, or funding has not been granted for new construction. When renewal to the contract for these properties comes up, and there is the market rate is soaring, such as in Miami, many of those properties, we face them going into market rate value. And so we lose the affordable housing that we currently have for older adults to market rate values. And in Miami-Dade in particular, more than 50% of older adults are spending more than 30% of their income on housing.
Yeah. You know, so despite the fact that our population is getting older, as the chair pointed out, the changing demographics in the country, and that we already have severe housing affordability crisis for seniors, Congress hasn't seriously funded new dedicated housing for seniors in more than 5 years. Is that a fair statement?
That is correct, yes.
You know, a shortage of affordable housing is not only a problem individually for seniors, it's also a problem for our economy overall. When seniors spend more than they can afford on housing, then they're forced to cut back on other necessities. So they spend less money on transportation or food or health care. Reduced spending in these areas can cause depression, can trigger other health problems, which in turn can increase costs for taxpayers when seniors are forced to use more Medicaid or more Medicare services. So Ms. Garces, cutting off funding to the 202 program may have saved Congress some money in the short run, right, but how do you see the costs when seniors can't afford housing?
Senator Warren, as you mentioned, when seniors cannot afford housing, they are forced to make very difficult decisions. They need to spend the limited or their fixed income on transportation, on health care, on their time. They need to make decisions on how they will spend their time. Their cause on the strain individually and on the society, on the community. We also the lack of affordable housing can lead to poverty and homelessness. What we're seeing now is that 100,000 seniors are expected to be homeless by 2050 nationwide, and that is more than double the number that we had in 2010. And that is just part of the cost that we will face with the shortage of affordable housing.
Thank you. I think that's a very serious warning. You know, the 202 program has been a lifeline for seniors in Massachusetts, where more than 13,200 seniors live in housing supported by this funding. The typical income of a Massachusetts seniors living in 202 housing is between $12,000 and $15,000 a year. Nonprofits such as the Jewish Community Housing for the Elderly in Massachusetts and Leading Edge are leading the charge to try to convince Congress to revive funding for projects under the 202 program. And as we start looking at the 2018 budget, I hope that members of the Senate Aging Committee will take a very close look at this, and we might be able to work together to make sure that there's adequate funding so that there's more housing available for our seniors. Thank you, Madam Chair.